welcome back. And if this is your first session of the day, welcome to day 4 of Preemie Power Week. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation, CPBF, and your host for this event. The Preemie Power Week is the second of 2 international live series that CPBF is hosting in 2020 in recognition of World Prematurity Day. These education sessions are in collaboration with the International Family Integrated Care Committee, the Canadian Association of Neonatal Nurses, EFCNI, and GLANCE, the Global Alliance for the Newborn Care. For those not familiar with CPBF, we are a charitable organization, and our mission is to support and educate Canadian families of premature babies every step of the way. We believe that through consistent information, access to helpful resources, and peer support inside and outside the NICU, we can empower families, ensuring they are ready to care for their baby. Consistent information is especially important today when we are facing a global pandemic. With educational sessions like this, we intend to bring you the guidance of healthcare professionals and the knowledge gathered by researchers around the world. These are valuable tools to help our community raise awareness and advocate for the well-being of families and their babies. I would like to thank AbbVie for the unrestricted educational grant and Pampers for supporting the Preemie Power Week. And we are right now continue the conversation of the use of technology in the NICU. And right now it's leveraging digital technology to enhance the parental presence and involvement in the NICU. Greater parental presence and involvement has been associated with improved outcomes for vulnerable newborns and their families. Yet, the amount of parental engagement varies greatly within and across NICUs. We continue to face challenges in finding optimal ways to enhance parental engagement. During this presentation, we will discuss the development and initial testing and implementation of the Chez NICU Home Platform, an evidence-based, parent-targeted, web-based education and support platform aimed to enhance family integration in neonatal care. Implications of COVID-19 pandemic restrictions will also be discussed. And I have here with me joining live from Halifax, Dr. Marsha Campbell-Yeo, who is a neonatal nurse practitioner and clinician scientist. She's also full professor at the School of Nursing, Faculty of Health at Dalhousie University, and holds cross appointments in the Department of Pediatrics and Psychology and Neuroscience. Her Canada Foundation of Innovation funded research lab, MOM-LINC, Mechanics, Outcome, and Mobilization of Maternally-Led Interventions to Improve Newborn Care, is located at IWK Health Centre. She primarily holds grants examining maternally-led interventions to improve outcomes of medically at-risk newborns, specifically related to pain, stress, and neurodevelopment, as well as novel knowledge, synthesis and dissemination methods, and digital e-health interventions aimed at enhancing parental engagement. Dr. Campbell-Yeo, thank you so much for joining us here today. Such a pleasure to have you with us.
Well, thank you, Fabiana. It's just absolutely my honor to be here. And before I begin, I just want to say congratulations to you and your team with this Preemie Power Week. I've been logging in every day and have been so amazed with the content and the quality of the speakers. And as I said, I'm just really thank you for the invitation for me to share in that and tell you today a little bit about our Chez NICU Home project and how to leverage technology in the NICU to enhance parental presence and involvement.
Thank you.
Can you hear me and see my slides okay?
Yes, absolutely.
Excellent. So, you know, Fabiana, we've heard so many wonderful talks, and Dr. Carol O'Brien kicked us off this week about the benefits of parental presence. So I'm just going to really, in summary and brief, we know that there are so many benefits for babies with respect to greater parental presence in the NICU, supportive effects of their brain development, decreased stress response, reduced length of stay, improved growth. And, you know, we also know that these benefits aren't isolated just to babies. for their families as well. We know that greater participation in the NICU leads to better well-being for families, reduced stress, anxiety, depression. And while we know a bit about parental presence in the NICU, such as some information related to facilitators or barriers, such as being able to stay close to your baby, or the reduction of light and noise, and looking at ways to reduce restrictions and challenges around having long distances to go between home and hospital. Despite this information, we really have very limited understanding around what type of interventions that we can actually improve the parental presence and involvement in our NICUs, and especially around technology. And so we were really excited in 2017 when we were able to launch our Chez NICU Home project. And this project really was aimed to develop, refine, test, and implement an interactive e-learning health platform to increase parental presence and involvement of families in the NICU. And we were so thrilled to have this funding through COA, Cisco Canada, and IWK Health Centre, with a target not to separate families, but to actually create a way for families to be able to be more actively involved, be more present in the NICU. And so just to sort of point the picture of the context, which you'll see later in the presentation, our project, the Chez NICU Home project, was aligned in the same timeline or period as we were moving from an open bay unit to a single family room, fully single family room unit. And so what did we do? Well, first we had to see what was out there. What was the quality of existing parent-targeted digital technology in the NICU? And we needed to also ensure that there was ways to have parents and care providers actively involved in every part of our project. So not only did we have parent partners on our research team, care providers, but we actively engaged them in every single step, and you'll see how we did that in a moment. We also needed to figure out where we were starting from, because how could we effective technology, digital technology, without knowing where we were currently with how much the families were present and involved in our NICU, and also the impact of us moving from open bay to single family room. And lastly, we needed to really look at, was this acceptable to families? Was it feasible? How difficult was it to implement these kinds of technologies in the NICU, both from a parent and a care provider perspective? So we started doing a series of studies and reviews, trying to understand what was the impact of digital technology in the NICU, what was currently available to families if they searched on Google or on mobile applications. And not only that, but what were the preferences of families in the NICU to receive this information? So these are some of the students that helped me with these, and really in brief, just to we found was there weren't a lot of studies. Those that were small. There were not a lot of robust findings to really help us draw conclusions on the actual impact of these digital technologies. In addition, we found that the online resources were actually rated as low to moderate in quality, and that even the applications, although were better, likely because they were more recent, still were only rating at about moderate scores in terms of content credibility. And so we knew there was lots more we could do to offer to families when we were creating this new platform. So where do we start? Well, also we wanted to think about what would be engaging for families. I think we have to think about that when we employ digital technologies in the NICU. We need to think about initial branding. Was it we wanted to make colors and fonts that were warm and friendly and peaceful. We depicted the tulip as our main logo, and we wanted to do this because we saw that it was a delicate spring flower We wanted to think that the petals represented the family, baby, and support. So this is sort of was one of the initial branding that we decided upon. We also knew that we wanted to have standardized, evidence-based information that was able to be readily updated, because that was one of the gaps in some of the things that were there. So we actually created a linked library. We did random evidence synthesis. We were able to link this evidence to various parts of the literature within the website, and we're able then to do regular updates so that we could keep the information current, so that families actually had the most up-to-date information. So from the literature and expert feedback, we first thought, okay, we needed to have modules around parents as partners, comforting your baby, the environment, fluids, feeding, nutrition, common NICU conditions, understanding variations in gestational age, and of course, discharge planning or the journey to home. We wanted to do more. We really, again, as I said, we had to feel that parents and care providers really were integral parts. So we reached out to them about the learning and content areas. We did through survey, focus groups, and iterative testing, and I'll tell you just a little bit about that. So we first asked families, what enhances your experience? What makes you be able to be present? And we asked care providers too. And we had almost 80 respondents. And what we found was healthcare providers ranked that the ability for families to be involved and present really ranked the being involved in care was really why they were there. And interesting, although parents ranked that as very important, they identified social support as the greatest predictor of whether they would be present in the NICU. This really told us we had to go back to our planning and think we needed to include ways for families to feel like they had, were able to have social support, to connect with others. And we also recognize a difference in mother and father. And so we wanted to make sure that our platform was able to provide individualized teaching and sort of targeting both parents. When we asked parents about their learning needs and preferences, what we did this was through focus groups, and we did in-depth analysis, asking families, how do you learn best? What was most helpful? What would you want to know now that you're in the NICU? Tell us about your experience and what we can do to make it better. Well, what families told us that they wanted reliable information, evidence-based, and they want reliable technology, but they never wanted it to replace the face-to-face interactions with healthcare providers. They saw it solely as an augmentation to their care. And they also spoke a lot about the need to have more information about what their role was when they were in the NICU, and also how that role or what they might do for the baby might change based on the baby's gestational age. They also told us very clearly that they wanted more pictures, more videos, more ways to learn rather than just text. We also were able to speak to 23 parents initially, doing very in-depth, think aloud, walking them through the platform, telling us what they saw to understand their user experiences and perceptions. The main strengths they told us was they felt that it was easy to navigate, it was easy and intuitive, it was very appealing to them, and I think what was very exciting for us is they thought that the content was clear, understandable, and very trustworthy because it was obviously evidence-based. So there was weaknesses too, primarily in ways to navigate, ways to log in, ways to integrate into the actual standardized care. And we took all this information and we created this into the next refinement of the platform. So while we were doing all this, we also had to see where we started. So example, we couldn't tell what the effectiveness of the intervention was without knowing where we started. So we did some baseline audits. We asked parents, how much time are you spending in the NICU? What are you doing while you're there? And what factors do you think were associated with you being there? And so what we did, we were able to recruit 105 families. This was during when we were still open bay, and families had to be anticipated to stay over at least 5 days and provide consent. And what we asked them to do was to tell us and fill out daily diaries on how long they were there, what they did when they were there, and then we converted that frequency into minutes and calculated per day so that we could compare whether even families stayed 20 days or 50 days, but what families were doing each day. And what we found was, this was way back in 2018, that about 9 hours a day families were at the bedside. Moms about 8 hours and partners about 4 hours. But interestingly, when we look at what they were doing when they're there, so this role, if you start on your upper right in the yellow, it talks about that moms spent about 16% of their time while they were in the NICU providing skin to skin, and about 20% of their time either green, singing, talking, reading, purple, holding clothes, doing other activities, feeding, bathing, pumping, diaper changes, and about 16% of the time they weren't really involved in any type of care for their baby. Interestingly, when we looked at the partner now in the inner circle with the same color scheme, we see that they provided a little bit less skin contact, a little bit less pink in the other, and about the same amount of singing, talking, reading, or holding clothes. But it became very obvious to us that families and partners were about almost half the time they were present, but they weren't actually involved in activity. And when we looked at that data a little bit more, this is a recent study that we've just reported using the same data. And what we found was, it wasn't just father's presence in the NICU, it was actually how involved they were in the NICU that was actually associated. So greater father involvement was associated with reduced risk of symptoms of postpartum depression in mothers. So this really emphasized the importance of ensuring that whatever we created in the NICU had to target both mothers and dads, and really reiterated the important talk that Dr. Feely talked about yesterday about the importance of fathers. So then we moved to the single family room. Not surprising, this is some pictures of our new single family room. We have bed space, we have bathrooms and showers in every room, lots of space for families. And we wanted to make sure that we understood what that change did to our baseline before we were able to evaluate our technology. So we use the same type of treatment eligibility criteria, and we were able to recruit 74 families, 36 to open bay, 38 to single family room, using the same methods of having them do daily diaries about their presence and involvement. And what we found, not surprisingly, was that just having a single room, this is before they had the technology, we saw almost 10 hours more than families that mothers stayed, and about 12 hours more that dads stayed, or partners. Now, this is a very busy slide, and I just want to really point out to you that if you think about all the colors other than the green, that's what families were doing. So what we found was there was really very little difference in the amount of time that families spent in the open bay cohort or the single family room being actively involved with their baby's care. And yet they were there so much more. So there was a tremendous amount of time that families weren't actually actively engaged, even though they were there more. So what this told us was that while there was a significant variation on whether families might be present in a single family room or an open bay, we didn't see that same change in how involved they were. So it really meant that we needed to target using these interventions on having families feel entirely integrated and promoting active involvement while they're there. So we took all this information and we put it into our revised Chez NICU Home. This is our login page. You can see we actually made refinements so that when they logged into a family, so a baby, they were able to differentiate whether it's mom, dad, or grandmom. And so that we were able to do some targeted teaching and also understand where they were going and what they were doing. We wanted to make sure that the content was readily available on any type of device, so we spent a lot of time making sure that they could access it on an iPad, on a phone, on a home computer, and so that they would have the same experience. We refined, we redid our best evidence synthesis, we took all the information around from the parent groups, and we did some revisions so that our latest learns are really parents as partners, comforting your baby, again, creating a nurturing environment, feeding and nutrition, and NICU conditions, and gestational milestones in developmental care. We also changed a lot on our navigation, so families wanted different ways to navigate through. So we had benefits, so we could either navigate into the bottom, forward or backwards on the pages. They could have left-hand side bars to show their progress and how they were doing. We incorporated 14 videos, things on safe sleep, going home, transferring your baby skin to skin. And what was really exciting is we used families who were currently in the NICU to help us create this. We have professional photographers and videographers, but we used families so that the families using this could see themselves in these videos. We also honed in and made some changes so that it was really easy, much easier for families to track what they were doing while they were there, providing comfort, bathing, etc. They could track what they wanted with their babies with respect to growth. We also did some refinement in our discharge summary in that we wanted to make, this was actually something the staff make it very easy. So if people wanted to do all their discharge plans virtually using all the pathways, we could just actually print that report and have moms and dads and the healthcare provider sign that and have that part of the chart, trying to increase use in a standardized form. Families were able to ask questions to healthcare providers. Again, we've had over a 700 photo inventory of families doing different things to show how they can be involved. Families told us they like the idea of graphic design too, to actually show them, to walk through, give them visuals about what they might be able to do as being able to be fully integrated in care. We did staff videos. We did videos to help families log in. We have a back-end portal so that it's really easy as part of our admission process. Families are offered, and then they are added to the back end by the ward clerks, and they're able to access fully the platform. We're able to do some analytics to see where we can improve, where families are going, what they need. And in our first feedbacks, what we found was we really targeted the discharge pathway first, and we found that of the 318 people who responded, really all but 2% felt that it was very useful, and also the 35 now that we've just started looking at the learning chapters also strongly agree that this is very helpful to them. But then COVID hit. And so this really meant that it was difficult for us to approach families. Most of the research was stopped, and we couldn't really continue with sort of the impact piece of this, but we really wanted to have it readily available, especially from the virtual technology piece. So fortunately, we were able to pivot slightly and receive additional fundings from within a response to COVID-19, in which we were able to try to look at instituting clinical virtual care pathways so that staff could ensure that whether families, only one family member was in the unit, they would be able to transparently reach all families members with the use of the virtual information. We were able to do a needs assessment with families and in-depth interviews. And really what they told us is that, again, COVID, this is not surprising. They felt disconnected. Family and healthcare providers told us they felt that family integrated care was going backwards. Families felt broken. Families needed a way to move forward. And so what we're working on now is a way to be able to audit and have every healthcare provider ensure that all families are able to be onboarded, either provided virtual teleconferencing systems within the unit, either on an iPad, the family's personal devices, or in telecommunication systems in the actual rooms, that moms and dads would have access at home, and in the hospital. They could share information, and this would also help with discharge teaching. So we're moving forward to evaluate this, wanting to ensure that all families are offered. And so in the end, I just want to summarize that the Chez NICU Home is about having families and present in the unit, actively involved in the unit, providing them the support and connection they need to families and healthcare providers, and the education they need to ensure optimal outcomes. We are actively also lobbying, and this is just an information for those who are also lobbying around trying to ensure that families are not separated, either that they still are or in a second wave. And this is just recommendations. We are very excited to be able to include in this recommendations to provincial and federal funding about supporting mental health of Canada's and having families of vulnerable neonates on this list, as well as other groups. So I will say special thanks to all the people and all the funders who have helped with this project. And thank you to the Canadian Premature Baby Foundation for inviting me today, and all you do to support Canadian families.
Dr. Campbell-Yeo, thank you so much for teaching us, showing what you're doing at your unit. You have a wonderful unit with really supportive families who stay together. When I visited your unit a few years ago, I was blown away to see there was a bathroom with a shower inside each room. So that is incredible. So my first question to you is, with the pandemic and extended family not being able to come to the unit, or siblings, how is the Chez NICU supporting families that way?
Yeah, so that's a great question, Fabiana. We're lobbying strongly to have siblings come. I think what families tell us is what is helpful is all of the pictures and the videos, so that that will be able to, even children who may not be able to see what it's like in the NICU, they can see pictures, they can see things about what their baby looks like, and also, again, the virtual teleconferencing, the secure system, allows children to see their siblings.
So let's talk about the survey that we are disseminated across Canada to understand parent experience in the NICU during COVID. We just shared the link on our comments. We are hoping to have a lot of families and healthcare professionals helping us with that survey, because it's very important to understand the impact of COVID, because not all NICUs have what you have at IWK. So tell us about the survey.
Yeah, so thanks, Fabiana. So what happened was, when we started to look at the impact just locally of the pandemic, it became very clear to us that we don't know what's happening across the country. And when I talk about lobbying government, lobbying decision makers to try to ensure that NICU families are not part of those same universal restrictions, because they should be considered caregivers and able to be always with their babies, what happened is are asking us, well, what's the proof? What's happening across the country? How can we do national decision making if we don't know? So our national survey is really looking at what was the impact to families. And also there is a very strong mandate in that too, about ways to make it better, including technology that's acceptable to them. So again, we know that there's been other surveys done primarily looking at healthcare providers. This is very much directed at families. So if you've been a family or you know of someone who was in any Canadian NICU since March 2020, please, or currently, please go to the link and fill it out. We want to hear from you. We need that. Not only I may not help you at this moment, but it will help others, and it'll help to inform decisions going forward.
Absolutely, because the pandemic, it doesn't seem to be over in the next few weeks. So we really need that data collected to act and keep families together across the country. Dr. Marsha Campbell-Yeo, thank you so much for joining us here today. What a pleasure talking to you. I'm so grateful that you took the time to share what is happening at IWK and your experience with Chez NICU. So thank you.
Thank you, Fabiana. Always such a pleasure.
Thank you.